Hi everybody, my name is Melissa Koehl. I'm a doctor of physical therapy and Pilates instructor. Today, this video is going to be on how to improve your thoracic spine mobility. So that's the upper back, the part of your spine that's attached to your rib cage. One of my favorite things to use for that is a foam roller. Not necessary. If you don't have a foam roller, you can also use a rolled up towel to start with. And then if you find you really like your towel and you're getting tired of rolling it up all of the time, or you need something a little stronger, you can invest in a foam roll. I've had my foam roll here for about 10 years. It's probably the best $20 I've ever spent. I use it all the time. So I'm gonna teach you how to use it. So you're gonna start in sitting with the roll behind you, and then you lay back on your back, right about where your bra line would be, is a good place to start. We can do this in multiple areas, but that's a good area to begin with. Bring your hands behind your head and then bend your knees with your feet about hip width apart. Elbows are gonna go out to the side, or you could bring them in. You can kind of play with what feels better there. I kind of like to start with open because then we get the secondary benefit of stretching your pecs and your chest, but you can experiment with that part. Either way, you're supporting your head with your hands, and then as you inhale, you're gonna lean back as far as you comfortably can go. Take a full breath in. Exhale. Another round of breath there, and then on that next exhale, curl back up. At least 5 times, maybe a few more times, anywhere between 5 to 10. There's not a set length of time that's the right amount. You just want to listen to your body and feel when you notice it starts to get a little bit easier. And then you know things are loosening up and feeling a bit better. Good. So with the towel, let's say you don't have the foam roll, you would do the same thing. So roll up your towel. You may want like a big bath towel or beach towel so that it gives you a little more support. And then place it in just the same spot. The towel will be a little gentler if this is new to you. So with patients in the clinic, I start with the towel all the time, so there's nothing wrong with that. Especially if things are really tight, the towel might be your best friend. So you just lean it back, take your 2 breaths, and then use your hands to curl it back up. Now, the next thing you can do is you can usually split up with your towel or the foam roller your thoracic spine into 3 main sections, upper, mid, and lower. So if it feels like, that felt stretchy but not quite in the right spot, you can move the towel roll or your foam roll up just a couple of levels of your vertebrae, so a little closer to between your shoulder blades. When you're at this spot between your shoulder blades, you might want to do the elbows together version, just to give yourself a little more space so that the bones of your shoulder blades aren't digging into the towel. And inhale, reach it back. And exhale, curl it up. Just like so. And again, if you want to go even higher, you can kind of get right up to about the upper part of your shoulder blade is about as far up on your spine as you can go where this really is effective. So feel free to find just the right spot. Sometimes we have just that one area that really feels like it needs to be stretched, so you can explore that a little bit. And exhale. Good. That alone does a world of good. Very simple and effective. If you have a lot of tightness there that you're wanting to work on, I would recommend doing that at least twice a day. Once you stretch it once, it's usually enough to open things up, feel a little bit better. Then within 24 hours, our tissues kind of go back to where they were. So if you want to stay on top of that curve and improve the mobility more than temporarily, you want to make some permanent changes to that tissue so that it stays more flexible. You want to do it at least twice a day for a short period of time, maybe not the whole rest of your life, but at least for the next week or 2 until you feel things start to really loosen up more, until you feel that things have a more permanent change. And then you can do that as more maintenance type dosage, which might be a couple of times a week. So now the other thing you can do with the foam roll that's really nice is you can do a massage for the back muscles. So you start in more or less the same place, so around that bra line area, support the head and the hands, and then you lift your tailbone up and then roll toward your head and then push and roll it back toward your feet. Just going back and forth here with your head tucked in, but not so much that there's any strain on your neck. So you can lift the chin a little bit, or you can keep it forward. If with the chin down, you get a little more stretch to those muscles that you're massaging at the same time. So that's one way to make it more intense, is by having the head down. If you want to make it a little less intense, you can lift the head up. And then you just massage and roll back and forth like this for about a minute or two. You might get some snaps, crackles, and pops in the joint, which is normal and usually feels pretty good. All right, so that's the foam roll massage. And then the last thing that I like to do with the foam roll then is more of a combined shoulder stretch, lat stretch, and thoracic mobility exercise where you do hands on the foam roller, and you're on your knees, and then you're gonna push the foam roller away, rotate your shoulders, so externally rotate, thumbs up, press the roller away, tuck the chin down, and then extend in your upper back. This one you can hold a little bit longer since there's no direct pressure on your spine. It might be a little more comfortable to hold it 3 to 5 breaths. And then you can roll back, take a break, roll it forward again, thumbs up. The thumbs up position just gives you a little more space in your shoulder joint. And then roll it back. You can round the spine a little on the way up. Let's try one more time. Roll it forward. And roll it back up. All right, well, those were my top 3 exercises for mobility in the thoracic spine using your foam roller. I hope that you found this helpful. If you did, be sure to like and subscribe to my channel. If you're having any issues with pain, neck pain, upper back pain, shoulder pain, having good spinal mobility can be helpful for those things, and it's certainly safe to try. However, if you're having an issue and doing some exercises just from some things you saw on the internet aren't quite getting you where you want to go, I would highly recommend that you see a physical therapist so they can do a detailed evaluation of your body and get to the root cause of what's going on and what is the best treatment for you. As I said in the beginning of the video, I'm a physical therapist. I am available for telehealth PT visits for anyone in Illinois. If you have more questions on how that works, you can reach out to me, either leave a message in the comments, or you can go to my website to set up a free discovery session. We can talk about what's going on. Since the start of the pandemic, I've helped a lot of people over telehealth for all sorts of problems: neck pain, back pain, shoulder pain, hip, knee, ankle. We can really do quite a lot of good evaluating how well you move, what muscles might be tight, weak, etc., and get you set up on a program that's very specific to you. So if you have any questions about that, you're welcome to reach out to me, and I'm happy to help you out. All right, thanks for watching.